February is Heart Health Month, and many San Diego doctors are looking to raise awareness.
Yeah, not only is it the leading cause of death in the U.S. for more than 100 years, but it also impacts our first responders at an alarming rate. And now, artificial intelligence could be helping. Joining us now to talk more about this all is Dr. Parikh. He's a cardiologist and the director of cardiac CT at Image One in San Diego. Thank you for being here. And as a preventative cardiologist, what is your approach to heart disease, and how do you think we can stop it?
Yeah, those numbers are staggering. And it really is surprising that despite all the advances we have made in medical care using, with stents, medication, and procedures, heart disease continues to be the #1 cause of death in the United States. And I think a big reason for that is because we have been using this reactive approach to care rather than a proactive approach. So heart attacks happen in the heart because you have plaque buildup in the heart, and that plaque ruptures and causes heart attacks. Now, that plaque takes decades to develop. And so we have multiple opportunities to take a look and see that plaque. And what we're doing now, and the approach that we're advocating for, is that if we do a CT scan of your heart, you can detect that plaque early in your heart, detect what type of plaque you have in your heart, and you can treat that very early.
Let's take a look very quickly at some statistics here, which are really frightening, doctor, when you get down to it, about the number of cases. And look at this. Heart disease causes 22% of all U.S. deaths, leading cause of death in the U.S. for the last 100 years. Every 34 seconds, one U.S. heart disease death. And I know Zara's going to ask you a question about numbers and why they're important.
Yeah, everybody kind of talks about knowing your numbers. Yeah. What numbers do you believe are important?
I think traditionally we've been talking about knowing your numbers. Every February comes around, right? And we say, know your cholesterol, know your blood pressure, know your blood sugar, and all of these things. But I want to take this a step further. There is a new technology using AI to look for plaque buildup in your heart and measure the exact amount of plaque in your heart. So I say that the most important numbers to know is what is your total plaque volume and what is your total non-calcified plaque volume. That non-calcified plaque is the soft plaque that can rupture and cause a heart attack. And if we detect that early and treat it early, we can stabilize that plaque and we can actually prevent you from ever having a heart attack.
Now, this is fascinating. We're looking at some of the video and the work that you guys do here in your lab. So tell us more about Braveheart. What is it, and how do you see this changing for the future for firefighters? Yeah,
well, firefighters, they are at increased risk of having heart attacks more than the rest of us, because they have a lot of stress. They're exposed to a lot of smoke and toxins. And so we started at Image One, with the support of HeartFlow, have started something called the Braveheart Registry. And what that is, it's a study to look for heart disease and plaque buildup in firefighters and measure exactly how much they have, and also to get them on the right track to prevent a heart attack. The goal of the study is very simple: protect the hearts of those who protect our communities. And so we're very proud to offer this. Image One is the first and only site in the country, and we are very much looking forward to welcoming our firefighters and getting this started.
So you'll be welcoming in to your clinic to make sure they're getting checked and kind of being proactive.
Yes, we're going to be proactive. We want them to get scanned, then to get treatment, get on appropriate medications, and if needed, procedures. But this will be something that we are starting off, and I think that we're going to save a lot of firefighters' lives, and I think we're going to do a lot of good for the community. So we're very much looking forward to it.
Yeah, it's happening right here in our own backyard.
Yes.
Yeah, we don't hear about the studies across country for a change. It's right here in Kearny Mesa, as a matter of fact, right?
Yeah. First site, but we are hoping that we can expand this to other communities and other places across the country.
All right, Dr. Parikh, thank you so much, and thank you for what you do.
Thank you.
Thank you for being here.